Welcome, everyone. My name is David Dodick. I'm the chair of the American Brain Foundation. I want to thank you very much for taking time out of your evening to join us this evening. I also want to thank you very much for your generous contributions to the American Brain Foundation. For that, we're very grateful. I hope for those of you who attended prior salons have found them to be time well spent. I know I certainly have, where we provided up-to-date research and advances in a variety of different topics such as Alzheimer's disease, and stroke, and epilepsy, COVID-19 in the brain, and much more. And tonight in particular is an exciting salon, I think, because of the topic that we'll be discussing and because of the expert speaker that we have tonight. The topic, of course, is highly relevant to each and every one of us: lifestyle and the brain. We all want to protect the health of the most important organ in our body, the brain, and the extent to which lifestyle factors can affect the health of our brain long-term, as well as short-term, is of primary importance to all of us. And tonight, we're very lucky to have one of the best possible experts on brain health who took time out of her busy schedule to talk to us tonight about this topic. Dr. Orly Avitzur. Dr. Avitzur is a neurologist, and she's the president-elect of the American Academy of Neurology, who will assume the presidency of the Academy, which is the largest professional association of neurologists in the world. And she'll assume that mantle in April of 2021. She's a clinical instructor at Yale University School of Medicine in New Haven, Connecticut, a clinical assistant professor at New York Medical College in Valhalla, New York, a practicing neurologist in Tarrytown, New York, and a medical consultant to the New York Rangers. And I didn't know that until tonight. And as someone who was playing hockey since they've been 4 years of age, I have to speak offline to Dr. Avitzur about that one. She is a medical writer and the editor-in-chief of Brain and Life. Brain and Life is the American Academy of Neurology's patient and caregiver magazine and website. She has been writing for Neurology Today, reporting on trends and innovations in the practice of neurology since 2001, so for 2 decades, and she's an associate editor for that publication. For 10 years, Dr. Avitzur served as a health editor for Consumer Reports and as its medical director from 2015 to 2018. And she is the recipient of several Apex Writing Awards, as well as the 2009 AAN Journalism Fellowship Award. So it's my distinct pleasure to introduce and welcome Dr. Avitzur to this American Brain Foundation Salon. And Dr. Avitzur, thank you so much for being here tonight with us.
Thank you for inviting me, Dr. Dodick. It's a pleasure to be here. I'll take the first slide. What I'm going to speak about initially tonight is a little bit about the ABF and the American Academy of Neurology and our partnership. We had a long partnership and we work together towards brain health and towards neurologic conditions and disease and research together. And I'll go into a little bit about how that works. I'll also talk about the Brain and Life community, about articles that we write for Brain and Life magazine, and be happy to answer some questions at the end of this brief presentation. Next slide. So the ABF was founded by the AN in 1992, and we continue to provide the ABF with annual operational support. You can see that our sweet spot, the place that we all work together with a lot of enthusiasm, is to increase awareness and fundraising for research. Next slide. We try to support the ABF in addition by offering patient educational content. And if you go to our website, which is brainandlife.org, you will see how much content that we've built on neurologic conditions and diseases since we've had the magazine. And the magazine was initially called Neurology Now and is now called Brain and Life. And as you can see, our covers have had some very well-known celebrities over the years with neurologic conditions, and we feature them in order to get readers interested in certain conditions. Next slide. We have 1.6 million readers at Brain and Life. We also have a magazine which launched about 2 years ago called Brain and Life in Espanol. It's to offer similar content to Spanish-speaking readers. And we have over 18,000 social media followers. The collaboration is very important to us. The American Brain Foundation is an important member of our Brain and Life community, and we work together to provide patients and caregivers the resources and educational materials and knowledge, and to raise awareness for brain disease research. We offer a lot of wellness articles as well. People have a great interest in learning about the brain and how to keep it healthy. And so we have a variety of subjects that we cover in each issue, including wellness issues like practicing mindfulness. You can see we talk about how the human psychology is important, and we recently wrote about loneliness, especially during COVID. It's a subject that resonates with almost everyone because we are not interacting socially the way we have in the past, and how that affects one's health. Next slide. We offer a lot of material on nutrition. It is certainly a key element to brain wellness, and doctors do recommend fruits and vegetables to prevent chronic disease. That was an example of one of our stories, but we have a story on nutrition or food in almost every issue. Next slide. We also believe in exercise in almost every neurologic condition. As you can see, we talk about how to do it now at home when people are not going to the gym because of not either gyms being closed or not wanting to be exposed to people. People with neurologic disease are considered at higher risk for COVID-19, and so many are now working from home and they're adapting their workouts to home. The sketch on the left reminds me of many of my telemedicine patients, because we have been trying as physicians to mimic the neurologic examination virtually, since we are seeing some of us patients on the computer screen and not face to face. So we have them, those that don't have hand weights, we have them go in their pantry and reach for cans of soup or tomato sauce or whatever's available. And the woman on the left reminds me of my computer screen almost every day because I'm seeing so many patients virtually. We also talk a lot about different types of exercise like yoga and Tai Chi and a variety of exercises to help people. We're recently just covered an article about chair exercises as well for people with mobility problems. So if you can think of an exercise, we've already featured it in Brain and Life. Next slide. Everybody loves recipes, and we try to offer up recipes that will help with brain health. Many of you have heard of the Mediterranean diet, and we have had several articles that talk about the benefits and also provide many recipes online. And Dr. Dodick can probably attest to why magnesium-rich recipes are good for the brain in his headache practice. Next slide. Medication is a subject that is very, very interesting to readers. And so we try to have within our articles on specific diseases and conditions, we try to address treatment, including medication. And we also cover supplements a great deal, since that is an issue that we get probably the most questions about. We also talk about how important it is to keep your own records, to keep your own medication lists, including any supplements you might be taking, to help your doctors take better care of you, to help prevent medication errors, and to so that we can review them at every visit and help you take better care of yourself. Next slide. Our publication is as much for caregivers as it is for people with neurologic conditions. And so we try to address caregiving in every issue, including how important it is for caregivers to get respite when they can, and how to try to divide caregiving duties among family members if you're lucky enough to have a family in which different people can pitch in different ways. Next slide. We have more articles on the web at brainandlife.org than we probably do in all our print magazines, because we are constantly adding material and our issues only come out every 2 months. So in between that time, we are writing short stories and blogs and what we call web extras on giving short practical advice to people on how to prevent neurologic conditions such as stroke, on how to deal with financial issues like insurance or paying for medication, and how to advocate for lower prices for prescription drugs, and what you can do to reduce the cost of your prescription drugs. Next slide. During the pandemic, I called in the editorial team. We normally meet every quarter or so, but I asked everyone to meet once a week. And there were 28 of us neurologists from Brain and Life and Brain and Life in Espanol. And we met every Tuesday evening to discuss what was happening with COVID-19 and how we could offer relevant material to our readers on our website. And so we did a lot of writing and a lot of publishing of material that went out to our readership, who had a lot of questions about how COVID-19 affects their particular condition, as well as general questions, and used our resource to help get information that was practical and that was timely to answer the questions about this novel virus and how to manage it if you have a neurologic condition. We had a recent article on how to hug safely that was very popular. And of course, I know the salon recently met to talk about the link between COVID-19 and the brain. There certainly are a lot of neurologic conditions that are being raised as connected, including stroke, and we wrote about that as well. Next slide. So our Brain and Life in Espanol is led by Dr. Joe Servin, who is an epileptologist, but he and his team translate or help review translations of much of our Brain and Life material, and it's fascinating. I tried to build a team of neurologists who know Spanish from all different parts of the world, because Colombian Spanish is different than Spanish from Spain, and so on. So we have a wide variety of different dialects, and we all come together to make sure that our magazine is comprehensible to any Spanish speaker, and they do a great job. They're also specialists in all different neurologic fields, and they help us with content and with ideas for new stories, and they really are part of the team right now. We're very very proud of this magazine and its reach right now, which is to our Spanish-speaking community in the United States. Next slide. We also reached out to our prior covers during COVID early on, and we asked them to, if they would be willing to send messages to the public about the Brain and Life community. And we were really pleased to see so many who were willing to help and gave us some really inspirational messages about staying safe and staying the course, and how proud they were to be part of the Brain and Life community. On the right is one of our most recent covers, Peter Frampton, and his story is really remarkable. He has, as you know, he's a guitarist, musician, and he has a condition called inclusion body myositis. He gave us a wonderful video of inspiration and told people to continue to exercise. And in fact, his condition has broken new science because of his exercising his fingers every day through strumming and playing the guitar. It was thought before he developed the disease that finger weakness was a key part of inclusion body myositis, but his strength has really held up with the daily exercise he does. So we're very, very happy to feature him in a recent cover, and we're incredibly honored that he and many others here that you recognize probably were willing to give a few words of inspiration and community to Brain and Life. Next slide. Our relationship is strong. We continue to promote resources and raise awareness for the need for brain disease research. Next slide. And that brings us to the Q&A. I'd be happy to take any questions.
And so maybe while we're waiting for questions to come in, Dr. Avitzur, if I may, could I ask you a question? So when I was training to be a neurologist, and for many years after I was in practice, brain health wasn't something that we even talked about. It wasn't even a phrase we used. And we talked a lot about heart health. And so what exactly is brain health? What is your definition of it? And how is it different from heart health? Because, you know, we talk about diet and exercise and a variety of different lifestyle measures to reduce the risk of having a heart attack and perhaps stroke. But is there evidence that improving brain health can reduce the risk of diseases that we dread, degenerative diseases of the brain like Alzheimer's disease or Parkinson's disease?
Yeah. So first of all, what they share in common, the brain and the heart, are that diseases and conditions that clog the arteries to the heart also clog the arteries to the rest of the body, including the brain. And of course, arteries are the blood vessels that carry oxygen that is critical for delivery of oxygen to the organs. And when they become damaged, that will lead to arterial blockages, whether it happens in the heart or whether it happens in the brain or in the legs. And those blockages can lead to stroke. They can also lead to vascular dementia. And so when you talk about brain health and maintaining brain health, the treatment of conditions that are known to increase the risk of both cardiovascular disease, diseases of the heart, and cerebrovascular diseases, diseases of the brain, such as high blood pressure, diabetes, and high cholesterol, all can be managing those conditions will help reduce their risk as well. We also know that those conditions that increase cardiovascular disease or heart disease also increase the risk of developing Alzheimer's. So managing those conditions and being sure to prevent them through, like you said, exercise and diet, not smoking, controlling blood pressure, making sure that your blood sugar is treated through diabetes medications if you have that condition, that it all works together to in terms of prevention.
Thank you for that. We got a number of questions that have come in. One from Kenita Watson, who asked, does living in an urban versus rural environment affect brain health?
That's a very good question. And there have been some recent studies that have shown that urban environments, due to the increased pollution that is experienced, may also have higher risk of cerebrovascular disease. So to the extent that if you live in a city with a lot of pollution, there may be a slighter higher risk than living out in a rural area. But it is obviously difficult to control that type of thing. But we are learning more and more that there is some risk. That's one of those silver linings of COVID, however. There's been less pollution, our skies are clearer, there's less traffic. So it is probably a healthier environment than it was before the pandemic.
Thank you. We have a question from Huntley Hardison, who asks, across the lifespan, is there a change in the importance of magnesium, for example, during gestation compared with very old people? So across the lifespan, are there changes in one's requirement for or deficiency in magnesium?
That's a good question, and there are. I know that the nutritional needs at various lifespan stages vary, but I'm going to defer to you, Dr. Dodick, since you're the magnesium expert, to answer that one and help me with that one as well.
Well, there is some evidence that, the importance of magnesium and the extent to which magnesium needs to be replaced does increase with age, actually. And it's not quite clear the reasons for that. So magnesium does a lot of good things in the body, but from a brain health standpoint, it primarily reduces abnormal excitability in the brain. So there are certain conditions which increase the level of excitability, like epilepsy and like migraine, for example. And then other pathological conditions like traumatic brain injury, where there's a drop in magnesium after a concussion, for example. So magnesium kind of regulates the balance between excitation and inhibition, which is really important in the brain. And there shouldn't be too much excitation or too much inhibition. So it really controls the excitability in the brain. I'll also say too that magnesium controls the release of something called glutamate in the brain. And glutamate is an excitatory, it's the most abundant neurotransmitter in the brain that leads to excitation. And if too much of it is released, actually, as we say, too much of a good thing is not good. Too much glutamate being released is not good. It's not healthy for the brain. And so magnesium, through its role in balancing excitability in the brain, is important for a number of different diseases and for overall brain health. So that's how I would answer that question.
I would also add that we don't get enough magnesium in our diets, and we don't absorb enough magnesium as a rule. And so it is probably worthwhile to search for a list of magnesium-rich foods, such as papaya and spinach. I once looked up the perfect food because I wanted to get more magnesium and more calcium, and it turns out spinach has both, and I think kale does as well. So getting the foods through our diet and making sure that our diet is very diverse and that we have vegetables of all the colors of the rainbow, make sure that we also get the right vitamins and are more likely to be to get the kinds of vitamins and supplements that we normally need.
And just as a tip, because people look sometimes for to supplement the diet with supplemental magnesium, and there are a variety of different formulations of magnesium out there. I tend to recommend either magnesium glycinate or magnesium citrate, simply because they're better absorbed and they're more available to the body than, let's say, magnesium oxide. And typically we were recommending 200 to 400 milligrams of supplemental magnesium per day. It's important not to take too much. The most common side effect of taking supplemental magnesium is loose stool, so it can cause diarrhea if you're taking too much. So 200 to 400 milligrams of magnesium glycinate or magnesium citrate is what I would generally recommend. Important question here from Tina Di Rienzo. Are there any supplements or vitamins that you would recommend to maintain brain health? As you say, it's the most frequent question you get in Brain and Life.
It is. And before that, at Consumer Reports, when we released our supplement issue, our website crashed, and it's the only time that ever happened in the 10 years I was there. So supplements are the question of the day. And before I give you the answer, I do want to apologize. I wish that there were one magical pill that would help brain health and that would make us all really solve the problem of better cognition and improved health, but no such pill really exists, even in supplement form. So these days, in terms of not having a deficiency, if you are healthy and you eat a normal healthy diet and you're not a vegetarian, so you're not missing any essential vitamins from your diet, there is probably no need for additional supplementation. One exception might be vitamin D, and many of us have gotten our vitamin D levels done. Your primary care doctor might do that, and vitamin D has been shown to help prevent a variety of conditions. But in terms of brain health itself, there's really no vitamin to take if you're supplement if you're otherwise healthy that will make you healthier.
So, question here, is there any evidence that vitamins in people who are not vitamin deficient have any benefits? So I think you kind of answered that. And in saying that if you're not deficient, then there really is no need for supplementation. But maybe you could respond to that.
A study that came out about 5 years ago looked at an enormous number of people and who took a once a day vitamin, and in women it was found to be kind of a wash. It didn't help, it didn't hurt, but in men it was found to be more harmful than helpful. And so at that point, I decided that it really wasn't useful to even prescribe it for people. And I think, again, unless you have a deficiency, even taking a one-a-day vitamin is probably not going to help you and could possibly hurt you.
Thank you. There's a couple of questions coming in on COVID, not surprisingly. One question here is, my husband had a TBI, and I have noticed since COVID a decline in his cognition because of less socialization.
I think that's a superb question, and you really hit the nail on the head in what has been one of the great tragedies of COVID, that in order to stay safe at home, we're also much more isolated, and we have less interaction with people, at least face to face. Now, there are some opportunities and creative ways to try to remain social, and you could try that. It was with the husband, right? The husband of someone on the call, is that what you said? Yeah, with your husband, including findings, if he is able to attend and is willing to, finding some online sites, communicating with friends and family through FaceTime or through Zoom. There are some support groups now that are meeting online, quite a few of them, and they're finding that their attendance is even better than before because at meetings you can only get together regionally, but these support groups now are national and sometimes international. And so for almost every condition, there is an organization who is working on this very problem and helping people connect and also helping them get resources during COVID. It's often a case-by-case situation. I don't know what your husband's interests were, but if there's a way to bring them back inside and to continue to get him engaged, that would be a big help. But you're raising an issue that has come up over and over again in almost every household with a person with a neurologic condition. It's a very serious concern. What I'm hoping is that this is the last stretch and that soon we'll all be vaccinated and be able to get together and reduce this isolation that is so deleterious to people with brain conditions.
Yeah. Dr. Avitzur, another question here. For how long after an anoxic brain injury can we expect to see improvement? We are now 9 years post-injury, and it seems that when they notice improvement, it appears to come with an extreme awareness of any deficits. So they wanted to know if you could address that.
Yeah, so the anoxic injuries take all kinds of forms and all kinds of severity. 9 years is certainly a very long time after an injury, and it is sad that you have more awareness during that time, because that can sometimes be very distressful to the person who suffered the injury. But I would hope that, again, online you could get some help through counseling or through other means to try to address especially the distress that occurs during those times. I don't know if there's a time stamp. The longer that goes on, the more unusual it is to get a really substantial recovery. But I have certainly, I would never say that improvement can't come in various forms at various times.
Another question here, having worked with the Indian Health Service as well as practicing in an urban environment, I recall that the morbidity and mortality factors, especially post-traumatic ones, are very similar. Similar between, I guess, the experience with patients in the Indian Health Service versus practicing in an urban environment.
So is this, again, TBI we're talking about?
Mm-hmm. It seems that way, yeah.
Okay, can I get some more information from the person asking the question as to what those similarities are you'd like me to address? I don't know if we can get some feedback, Dr. Dodick.
This was Mr. Hardison, Huntley Hardison. Are you, if you're still here, you could unmute your mic.
Well, maybe we'll come back to that one.
Come back.
Let's go.
It was
here he is.
follow-up for the urban versus rural aspects of health. Thank you.
So in terms of TBI, I'm not aware of any environmental factors that are relevant. The only thing that comes to mind is access to care. It may be, many urban centers have TBI centers and more neurologists and other healthcare providers that can provide treatment options. And I know that in certain rural communities, they are harder to find, or one has to drive long distance for them.
Was there something else, Mr. Hardison?
That's all. Thank you.
Okay, thank you. Effects of COVID-19 positive on Alzheimer's to accelerate the impact and degeneration. My wife has lost mobility and is now in rehab 17 days with acute fatigue and now loss of her activities of daily living.
Right, so COVID certainly causes a tremendous amount of fatigue, and rehabilitation can take, we're learning, a very long time. And with people with neurologic conditions, anything that causes fatigue or even fever or one other source of stress can reduce the level of function tremendously. And so we see this, we see this with other conditions. It was present before COVID, but COVID is certainly takes a toll, and it's not unusual to see people deteriorate. I'm sorry to hear about that. And hopefully with rehabilitation and enough time, she'll return to more of a baseline for her.
One of the more common neurological symptoms of COVID happens to be this brain fog that even just young, otherwise healthy people can experience. And so in someone with Alzheimer's disease, that brain fog could certainly exacerbate their cognitive status. And hopefully it's transient, because in most people, when the infection clears up, in most patients, the symptoms like fatigue and cognitive fog tend to resolve. So hopefully, as Dr. Avitzur said, that will get better over a short period of time. Another question here is, beyond regular supplements, are nootropics bunk?
In a word, yes. I wish again that my answer could be something else, because I know it's not a popular answer, but again, there is no substance that I know of yet, and Dr. Dodick, you can correct me if I'm wrong, that can actually serve that magical function of helping brains be healthier.
Yeah, I would agree. Another question here, what are the possible dangers to the brain of a vegan diet, and what supplements can help? Right.
So the thing that comes to mind the most are the B supplements, including B12, and in anyone who is a vegan or a vegetarian should make sure that they have a very balanced diet and that they get their nutrients from those sources. Most physicians and primary care doctors will pay special attention to potential deficiencies in people who do have a vegan or vegetarian diet. I will tell you that I come from a long line of vegans. I'm not one, but I have 3 brothers who are, and they seem to get a very balanced, healthy diet without the help of any supplements, and touted as a lifestyle that is far superior to that which us carnivores have. So probably will do fine. Neurologists who see you, if you were to present with symptoms such as numbness or tingling, would immediately want to know about your vegan diet, so please share that. But otherwise, you should be able to do very well. I once was told that when we go to the supermarket, even if it's a virtual supermarket these days and you're getting deliveries, to try to select vegetables and fruit from all the different colors of the rainbow. So you want a little bit of purple, red, orange, and green, and mix it all up. And that ends up giving you the most balanced diet. And so I tried to do that and to have plenty of vegetables and fruits in my diet, and it's easier to remember that than to try to think about all the different vitamins that each particular vegetable supplies you with.
Great. So question here, what supplements can help migraine and at what dosages?
So I once did an article, I'm a little bit humbled answering that in front of Dr. Dodick, whose whole career is spans on migraine, but I once wrote an article called Your Neurologist Has Migraines, and I interviewed only migraine doctors who also got migraines themselves, and I asked them what supplements they took. We've already spoken about magnesium, and the dosage that I have recommended and they have recommended is around 400 milligrams. Dr. Dodick, you may want to correct that. If that's too much, I ask people to pull back and take less. You can find it in smaller versions. Also, B2, which is riboflavin, in a similar dose. They touted that a lot. And some of them also took CoQ10 and felt that that was good in migraine prevention. And there are several others as well, but those are kind of the top three that I remember. And I still do recommend them to my migraine patients. I have to tell you, and Dr. Dodick probably has similar experience, I have gotten more credit for those supplements in preventing migraine than anything else I've done in my entire career. People say it worked so well. I bought some for my son's teacher and my neighbor, and people seem to think it's very helpful. So although studies suggest it's helpful, I'm not sure that it deserves that much credit per se, but it seems to be, the science holds up with that. Is that right, Dr. Dodick?
Yeah, I would agree. Those are the three for which there is evidence from placebo-controlled trials. Now, the three of them have not been studied really in combination, but we often recommend them in combination because each of them reduces the frequency of migraine by about 30%. So if you can get an additive effect by combining them, and there's no danger or harm to adding them, that's typically what we tend to do. But I agree with everything you said about the particular vitamins and supplements that have been shown to be effective, as well as the dosages. Sometimes the other thing we recommend, because many of our patients with migraine will have insomnia or sleep disruption. And so sometimes we'll offer them melatonin, 5 milligrams of melatonin, up to 10 maybe, but as low as 3 milligrams of melatonin, because sometimes that's helpful for sleep. And there's some evidence that melatonin, perhaps because other non-sedative effects that it has in the brain, may be helpful to reduce migraine frequency as well. So we don't offer that in everybody, but for people who happen to also have trouble sleeping, whether it's getting to sleep or staying asleep, sometimes we'll recommend melatonin as well.
I'm glad you brought up sleep, Dr. Dodick, because when it comes to brain health, the importance of sleep has come up recently in the last few years, and we don't give it enough time. We certainly need to counsel all our patients about sleep. When I often ask people how many hours a night they sleep, their answers are very surprising. Where we all should get at least 7 hours of sleep every night. It turns out that a lot of very important things are happening in our brains to refresh us and to maintain brain health during sleep. In addition to that, when you don't sleep well, you're at higher risk for neurologic symptoms like migraine. And so it is very important to do that. Insomnia is an enormous problem in the United States. We have studied it a lot, and I paid a lot of attention to it when I was at Consumer Reports, because people tend to take too many sleeping pills as well. And so the after effects or side effects of sleeping pills can be quite serious, from tiredness during the day, and also some consequences in terms of sleepwalking and feeling drugged while driving. Some serious issues can occur with sleeping pills. So I want to second the recommendation for melatonin It is very helpful, it's gentle, and it doesn't have the potential for risk that sleeping pills do. So
Yep.
thank you for bringing that up.
Absolutely. There's another question here, Dr. Avitzur. What is your opinion on the apps that claim to stave off memory loss and dementia by having you solve tests and puzzles?
So brain teasers or brain apps have sometimes come with this recommendation or pronouncement that they will keep your brain healthy or prevent Alzheimer's or some other similar touted benefit. And I don't think that an app per se can get the credit for all of that, but I do think that there are remaining cognitively healthy by keeping your brain active is important. So in addition to physical exercise, we talk about cognitive exercises. It makes sense to, especially now during COVID, when we all are kind of alone with not the same social interactions that we've already discussed, to think about learning something new, whether it's by an app or whether it's learning a new language or learning a new board game or picking up something manual like knitting or wood crafting. All those things have been found to keep people sharper by just being more engaged and more active. But whether one app per se or a brain teaser can take all the credit for that, I'm not so sure. But a combination of that, taking the initiative to continue to keep your mind active and healthy is certainly something that we recommend.
Yep. You've kind of answered this in several different questions, but this person has a question specifically about her husband, and that is, what brain exercises would you recommend for her husband who has Lewy body dementia? She's tried matching exercises, cognitive exercises, but he gets frustrated. And parenthetically, she also has him taking 10 milligrams of melatonin, and it does help. So that's just confirming what we talked about, but going back to cognitive brain exercises for him.
So there's no, again, one specific exercise, but I would not do something that is frustrating. So it depends on the individual. So when you see your husband, if he becomes engaged by a certain book or a certain video or a certain game, then it is those things that get him engaged or keep him happy, or you can tell that he's not agitated with them. Those are the types of activities to continue to do, because at the end of the day, you want to maintain his ability to be content and to be satisfied, and not to give him something that is aggravating or too challenging. So take the lead from him and see if there's something that he used to love to do that he can still do in a different way. That might be the way to go.
Thank you. I think we've gotten through almost all of the questions, and unless anybody has any other questions, I'm going to ask another one. So for physical and for heart health especially, we can measure this with currently available blood tests or imaging tests. But how can people have their brain health measured or tracked to know if they're on the right track?
So that's one of my favorite questions, because what a lot of people don't realize is that doing too many tests or tests that are not called for have really negative consequences. So when people come to us, and every neurologist, every doctor gets this and say, I just want you to check me out, do a full body scan and just make sure I'm okay. And there are places that will be very happy to accommodate you and give you full body scans, including brain scans. And the problem is that you end up finding incidental kind of things that may suggest disease and lead to further and further invasive testing that can then cause harm. And so we don't recommend that you do test unless you're feeling that something is really wrong and it's well deserved to do. But I think if you're feeling well, and there's no need per se to measure anything with your brain, because the brain is a different kind of organ. You can tell if it's sick. You will have, for example, headaches or memory issues or balance issues or weakness of the muscles or sensory disturbances or dizziness. In the absence of all those things, I would not recommend that you go to have any additional tests done per se.
Thank you. Any other questions from anybody for Dr. Avitzur?
I see one more, Dr. Dodick.
You see one more?
Yeah, it says, can an inversion table be helpful at all, sending more blood to the brain?
That's an interesting question. I don't think I've heard that before. No, I'm not aware of that. I guess you know, the old version of that would be, can standing on your head also bring more blood to the brain? And it's, you know, not anything that will cause any permanent change for certain. So I would not recommend that unless you know of something I don't. Dr. Dodick?
No, I definitely would not recommend that, actually. That's not a physiological position to be in, and I can think of reasons why I definitely wouldn't do that. But no, there's no evidence that, in fact, if anything, it might increase the pressure within the vessels and within the head. And so that's not a good thing. So no, I wouldn't recommend that. But I can see why you would ask that question, because it makes sense, right? Stand on your head or have an inverted table and you get more blood flow to the brain. But the body's figured out a way to get what it needs to the brain adequately, unless there's a blockage, of course, and then we have a whole different problem. I don't see any other questions. Do you, Jane? You're on mute.
Yes, I see one more. It says, is there a migraine diet?
Is there a migraine diet?
Yes, so there are foods that you may want to avoid if you are prone to migraines, and pretty much most people know what they are. They're the classic ones are, for example, red wine or aged cheeses. If you have found that certain foods trigger headaches or migraines, you want to obviously avoid them. Otherwise, getting a balanced diet, the way we've talked about, and perhaps adding some of the supplements that we mentioned, magnesium, riboflavin, and CoQ10 may be helpful. But keeping a record of when you have migraines, a headache diary, and looking at the meals that you may have had and trying to see if there's a correlation or a pattern may be helpful in terms of avoidance. And that's one of the tasks that we ask people to do when they present with migraines.
Yep, I would agree. Well, we're about at time. Thank you all for giving us some time tonight to be with us. I really appreciate that. And I appreciate your generous contributions to the American Brain Foundation. And Dr. Avitzur, thank you so much for taking time out of your very busy day to be with us tonight and for giving us such valuable and important information. So I appreciate it. Thank you.
It's my pleasure. Thank you, everyone, for joining. I really appreciate it. Bye, everyone.
Thank you.
Have a great night, rest of your night. Bye-bye.